Okay, so this is going to be our Pharm review for GI drugs. Okay. Let's pick a good one. Okay, let's start with the easy one. Ginger, do you know what ginger is first? Where's my ginger? Ginger, like it's an herb, but it's also an antiemetic. You know what antiemetic? Emetic means to vomit, so we're against vomiting. We're going to stop the vomiting. So ginger, that's why they give people ginger ale, because it's supposed to have something in it that helps with nausea. Yeah, it's an antiemetic is anti-nausea, vomiting. So it's for the treatment of nausea and vomiting related to motion sickness, anesthesia, and chemo. So like your chemo patients, they may have on the ginger pops or ginger ale. If you have somebody who's come out of surgery and you're starting out with clear liquids, maybe if they want something to drink, you do ginger ale. They're still nauseated. Let's see, what are some things? Might cause minor heartburn, but it cannot be taken during pregnancy or lactation. It may increase your bleeding times in patients with coagulants.
So then why do they make the pregnancy pops ginger?
Maybe they're not much ginger, that's just a placebo.
So what are the side effects? That's weird.
Side effects, just GI, minor heartburn. And it says it may increase the effects of calcium channel blockers. So what does calcium channel blockers do? So does it slow your heart rate a little? So that's an easy one. It says to check for epigastric pain, monitor blood pressure and heart rate, watch for palpitations, watch for blood glucose, and coagulation panels like PT, PGT. And this would be somebody who's on it all the time, I'm sure. This is a herbal thing, so a lot of places don't use them unless it's like a chemo unit, maybe the OBGYN or post-op. Okay, here's a good ones. We just did ginger, and I'm already recording it, so y'all be if you already missed one. So you can see the board better. Alright. These are our H2 receptors antagonists. Did everybody get that cheat sheet that I gave y'all about the Pharm at the beginning? No. The Pharm, it said terms on the front. It was like 3 pages.
No, ma'am.
I thought I gave it right. I'll go get you that. Alright, H2 receptors antagonists. These are your histamine H2 receptor antagonists. Anti-ulcer agents. So, treatment is for duodenal ulcers and GERD. Does anybody remember yesterday what our drugs were that we said?
What does that say? Anti-what?
Anti-ulcer, sorry. We went over these yesterday, and they end with something.
The D-I-N-E.
These are your D-I-N-Es, your dines, remember? Dine, eat, diner. So this is famotidine, which is Pepsid. Ranitidine, which is Intact. Ranitidine, Pragmet, and I don't think she's on this one. An accent. So I'm gonna write them down. These are real common, so these would probably be something good to know because they like those common drugs.
I think it's in the like sometimes when you're taking these tests and make it easy.
Yeah, they should have incorporated it. We've talked about that. It should be in every level, every anti-ulcer agents. They're going to help get rid of that acid. They can cause dizziness, drowsiness. Ooh, they decrease the sperm count or impotence. Ooh, I didn't know that. We did. I think I would say, sorry, you're going to have to stop heartburn. Smoking interferes with alcohol products, with aspirin, NSAIDs, excessive amount of caffeine. So all the same things we talked about. That's just going to make the acid worse. So if you're taking something to stop the acid, but then you're drinking a Coke, it's not going to do any good. The main thing to worry about that one is drowsiness, headache, and then just diet modifications like I talked about. Everyone good on that one? Should be on the board. The dynes, yeah, they end in dyne, D-I-N-E. And it's in your book too, like the pages that you can go back and look at this. This is one we talked about in lecture 2. Sucralfate or carafate is that's the generic, and this is the trade.
What is that?
Carafate, that's the or mucosal protectant. That's the one that is anti-ulcer, but it soothes, it coats over the ulcers.
So these are anti-ulcers too?
Yeah, it coats the ulcer. The others, the H2, block acid production. This just coats the lining of the stomach. It's management for peptic ulcers. It forms a thick protective paste, and that's what coats that ulcer. So then the acid in the stomach can't irritate your stomach ulcer. Does that make sense? Kind of like a Band-Aid, but it's a medicine. It coats the ulcer in the stomach. Dizziness, drowsiness, constipation. I think every drug causes that. They just put that on there, I think. We definitely would want to report any changes in their bowel habit. And you want to take it the entire course. And take it 1 hour prior to meals on an empty stomach. Why do you think that is? Right. Take 1 hour AC before meals to allow it time to work.
So this, you record this, right?
Yes, ma'am. So that gives it time to coat the stomach on an empty stomach and work. So remember, we're just covering up that ulcer. Like milk. Some people used to drink buttermilk, and that would do the same thing, I guess. Similar. Buttermilk's real thick.
Ain't that the one they give you a week?
Buttermilk is real. I remember my grandmother drank a lot. It tastes sour to me, but it's super thick. He probably had ulcers, and that's what made it. But it says tablets may begin to dissolve in the esophagus, and client cannot swallow effectively, causing a choking risk. So make sure you're taking it with extra fluid. I mean, that makes sense. Anybody, especially if they have trouble swallowing. Everybody got that one? And any of the drugs that they say take before meals, there's a reason. It's usually because it needs to be on an empty stomach to allow it to work. So it doesn't have to be just GI. There's lots of drugs that have to be taken before meals, and that's to allow it to break down, because if you take it with food, Like antibiotics you want to take with food, so it lessens the GI irritation. But some meds you have to take on an empty stomach to allow the acid to digest it, and then it absorbs first. Otherwise it gets mixed in with your food and is not as effective. So when you're doing your questions, if you come across one, think about that. If the choice is to take an hour before meals, think about it. Even if you don't know what the medicine is, but you kind of have an idea about that patient, think about that. Would it be more beneficial to take that medicine before, and why? And that might help you get the answer. Let's do this. Are you ready to get on that one? It's also known as atropine. Has anybody ever heard of atropine?
Yes.
Where'd y'all hear that at?
One of them said,
Monodal, monox, alogen. Now, atropine is one of those drugs that can do lots of good things, and they use it in lots of different areas. Atropine is something they give you before surgery to decrease secretions, oral secretions. So that's why you wake up and you've got the cotton mouth real bad after surgery, because atropine dries up your mucus secretions. Okay? It can also be used. What's Lomotil for? Anybody heard of Lomotil? Antidiarrheal. Low motility. Usually these drugs are just named after like what they do. They just break it up and make a new name of it. Low motility, it's an antidiuretic. I mean, not diuretic, sorry, antidiarrheal. Antidiarrheal. And atropine can also be used, like it decreases saliva production, so like in surgery, like I said, but they also give atropine in cardiac events. Okay, so it's also can be cardiac too. Not just for the saliva production, but if the heart takes it up and uses it. So Lomotil is antidiarrheal. So it does a lot, right? It's used for chronic diarrhea. You have inflammatory bowel disease. It can decrease the ileostomy drainage. Inhibits GI motility, so it's going to slow your bowels down. If you get toxic on it, what do you think is going to happen? You've taken too much, now you've got what? Constipation. You've taken too much antidiarrheals, it slowed you down too much, and now you're caught and constipated, so that's a side effect you got to watch for. It's got an anticholinergic effect is what the atropine does. Watch for constipation. Like I said, an adverse effect, what we expect is dry mouth, so they give it for that. They want to take plenty of fluids, because even though they've got diarrhea and you're trying to slow it down, you still want to give fluids, because we know if they get too much of it, it'll stop them up. So drink plenty of fluids, because their mouth's going to get dry. Hard candy or sugarless gum to moisten their mouth. Things like that, okay? It's a little bit of an opioid, so it's a little bit of a pain that it slows everything down. Did y'all learn this in your live ATI for anticholinergic? Y'all got that one? I'm going to put this up here. This is on this card. And they may do this if y'all do your live ATI later. For any kind of anticholinergics, and remember choline is a neurotransmitter. Ergics. So for any of these, this is the little saying they say to remember. Hot as a hair being a rabbit, so you're hot, it makes you run hot. Dry as a bone, because your mouth's going to be dry and your secretions are minimal. red as a beet, because it makes you flushed. Mad as a hatter, might have some confusion. And blind as a bat, because you're going to have blurred vision. Dizziness. That may help remember anticholinergics.
Mad as a what?
Hatter. A mad hatter or Alzheimer's. Because it makes you run hot. You're hot natured, your skin and mouth is dry, skin's red, confusion, and blurred vision. That's what happens when you take a anticholinergic. Watch for I know, because like I said, we know it's going to slow everything down, so we've got to make sure our kidneys and bowels are still working. We'll make sure that they're putting out urine and that they're not getting constipated. Check for bowel sounds, again, because it's anything that's anti-diarrheal, you're going to be listening to the bowel anyway.
Okay, so it's going to make you hot, red, blurred vision. What did you say about the mad?
Confusion, maybe some
Mad Hatter's confusion? And what was the, dry?
dry mouth, dry as a bone. It's just hot, like temperature, they feel hot. They feel flushed and hot.
Okay, so the red as a beet would be, red as a beet would just be skin.
They're flushed, yeah, they're red.
That's you. And the beets are nasty.
That's what I'm at. And you can look up like examples of anticholinergics and tell who's got the. Will you look up a couple like trade names of anticholinergics real quick? Just see what some of our trade names that are over the counter are. One modal. Oh, you got one?
How'd you get that book?
I bought it.
From who?
Barnes and Noble.
How much was it?
$30.
Iosapamine. This says peroxide, linolene. Oh, Ditroban. Yeah, that's the care and Netrol. So those are bladder, yes. So just look up when you have time when you're studying. You can look up anticholinergics.
So it's for what though? Like bladder?
It can be Detrol is for bladder spasms and stuff because it's an opioid base, so it's going to slow everything down. But they use it also for to dry oral secretions before surgery, and then for the bowel where they had diarrhea, you can slow the bowel down with it too.
Okay, you said use it for the.
It's anticholinergics. This is what they do. So any anticholinergic, that's what you're going to see. Metamucil, Citracel, y'all know that's just fiber. I'm not even going to tell you that one. You already know. Same things you're going to watch for their stomach and bowel patterns. Go Lightly. Here's your Go Lightly card. This is the one. Has anybody ever had to prep somebody for surgery with Go Lightly or had to take it yourself? Jeez, it's bad. It's a jug, and it's like powder and psyllium, and you have to mix it with water and drink it, and it makes you go to the bathroom. It cleans your colon out. It's called Go Lightly, and there is no going lightly with it. It is going urgently all night. But that's what they do as a bowel prep. So if you see Go Lightly, that's what that one is. Okay. Yeah. Clean Prep, Co-Light, New Lightly, Go Lightly. They're all the same thing. It's trying to get rid of your stool in your colon before a colonoscopy or something like that. And you, as a nurse, you might be doing it the night before because you'll have your patient be going in the morning. So, and they don't like drinking it. Dulcolax. Do you know what Dulcolax is?
Yeah.
Laxative. That's laxative usually. So when they make up these names, the trade names are always kind of try to give you a little hint to what's in there.
What was the other name for Go Lightly?
Yeah, there's tons of them. Clean Prep, Go Prep, they're just colon grip. This Biconal. It's Dulcolax. This is part of your Go Lightly too. They give you 2 Dulcolax tablets to take first. Let those start working, and then you have to start drinking the liquid. Okay, so see it has laxative, that's the same thing. To help treat constipation, but again, we want to watch for dehydration and any kind of abnormal bowel patterns. If it gets too much or not enough. I just want you to see that one because that's a real common one. Do y'all know what this one is? I'm going to put the trade name. See if you know what this one is. This is 2 different ones. Yes. Colace. What's Colace used for, Sam? It's a stool softener. So your little elderlies, if you're going to take care of them, they probably get 1 or 2 Colace a day, just to keep their stool soft. It doesn't make them go to the bathroom, it just makes the stool softer. It's more of an oil base so that they can pass it easier, and not having to strain so much. They come in little soft gels. It's just for the prevention of constipation and straining. Oh, this said they can be used regularly to soften fecal impaction. I didn't know that. So you could squeeze the gel out and put it in there. Never had to do that. We want to make sure they're getting plenty of fluid because we know fluid keeps their bowel regular, right? So any of these GI meds you're going to give with lots of fluid. Don't give them within 2 hours of another laxative or mineral oil, or you're going to have a code brown. You'll be having trouble. Oh, this is a good one. Mag citrate. Anybody ever had to take mag citrate? It tastes like lemon water, but it's like fizzy. And that's another one that helps you move your bowels. Magnesium.
So is that considered a stool softener or a laxative?
Laxative. It's on here as laxative, but it's magnesium salt. All it is magnesium, because magnesium is one of our, minerals that we have naturally, and it is a relaxant. So they can use magnesium if you're in labor. That's what they give to stop labor, or after labor, like if your blood pressure is too high. They give that as a drip, magnesium drip, because it dilates the vessels, and so they'll have lower blood pressure. So we'll just put magnesium up here because it has a lot of uses. So that can be in labor and delivery. So our uterus is smooth muscle, right? So it's going to relax smooth muscle. Relax smooth muscle. Relaxes uterus, and then lowers or relaxes blood pressure. So if you're going into what is it called? Y'all are doing labor and delivery now. What's it called after you have your baby and your blood pressure spikes up? Hemorrhage? No, when they're spiking up. Preeclampsia or eclampsia after they have it. So they'll give it for that. Because it relaxes the blood vessels. Remember, blood vessels are smooth muscle too.
It spikes the blood pressure?
No. If your blood pressure is high, like if you're in eclampsia, they give you magnesium in a drip, and it relaxes the blood vessels walls, dilating them, lowering your blood pressure. Dilating. And lowering. That's a big one to have. And then they also give it for pain medicine, because it's going to relax your other skeletal muscles too. So they use it for pain med. And then your colon, isn't it kind of muscular? Yes, so they give that for a laxative, because if you relax the colon, then you're going to poop. So it's also a laxative. So magnesium can be, it's a wonder drug. Okay? Hello. Bringing us. No. Sounds like might maybe 2 or 3, because I know it's not 1 and 4.
Okay. Are there 2 and 3 here today?
Does anybody know if level 2 or 3 is here right now?
Quit harassing people.
I heard that.
I don't know.
Don't know.
Try level.
Right next door.
Yes.
Thank you.
Room 2 or 16. Okay. So just know magnesium can be used for lots of different departments. As it does a lot. It's a muscle relaxant. Okay. Meclizine. Anybody know what that one is? Yes, true. Do what? That's the one you take, they sell it over the counter for motion sickness. Dramamine, good stuff, makes you sleep good. I may have to take some this evening. So antiemetic means anti-nausea, right? It relieves nausea, antihistamine. I can give this all of that. All these are the same thing as meclizine, and they help with nausea, motion sickness, vertigo. You give a lot of this antivert to the little old ladies for vertigo. You'll hear that one a lot if you work in a long-term care facility. Okay. Good oral hygiene on anything that's going to dry their mouth out, right? Because we want to keep their mucous membranes dry. I'm trying to think of stuff they might say. Do frequent mouth washes. I'm trying to think of NCLEX from their point of view, what they would ask you. Take at least 1 hour before you're going somewhere, if it's taking it for motion sickness, because it has to have time to work, okay? Let's see. Compazine is another one. It's not the same, but it's another drug, but it does the same thing. It's an antiemetic for nausea and vomiting. So you might see meclizine and then compazine. They sound the same, but they're not the exact drug, but they both still help with nausea. So you might see that one. The zines. Think of some way to remember that helps you from throwing up. Amazing. I hope you remember that one. It's also called Levsin. Have y'all taken that before or heard of that one? Given it? It's an antispasmodic. It's for spastic bladder. So what if we're talking about bladder and bowel? What is the thing of nursing measure I'm going to be doing?
Hydration.
Hydration, but watching their eye nose. Good. Give it for irritable bowel because same thing, it's an antispasmodic. So if you're having irritable bowel, you're having to go to the bathroom a lot, so they give that to stop those spasms, to kind of calm the muscle in the colon, and so stops you from having so many bowel movements. Okay, so watch your INO on that one. Same thing, good oral hygiene, sugarless gum or candy, changes in your urine stream in males because they may start having a deep, since it's spasmodic, antispasmodic, they get toxic on it, then they're not going to be able to push their urine out. So watch that one in males. Alright, last group of GIs. We all good on this one? Alright, we went over this one yesterday, this whole group. What were the zoles? Proton pump inhibitors. Yeah. Gastric pump inhibitor. Anti-ulcer agent.
Is it gastric pump?
Yes, gastric pump, sorry. Thank you for correcting me. Gastric bump. Treatment of GERD, because remember we're trying to stop getting that gastric acid out. So if I inhibit the pump for pumping out gastric acid, then that's going to help my GERD, right? Duodenal ulcers, upper GI bleeds. If you're hyper secreting saliva, they give it for that too. It just prevents the proton pumps from releasing acid in the stomach.
What are some of the examples of those zoles?
Nexium. Is it DSOM-PRAZOLE? There's a good list in your book, Christy. I forgot what page, but chapter 44 has got all of these. And so if you're doing flashcards, omeprazole, I'm just putting the zoles because just remember zoles, the ends in zole, because there's no way you can remember all of these trade names, but you can remember the little ends of them and know that those are the proton pump inhibitors, and that might be easier to try to remember all the trades. That's like Prilosec, Nexium. So, because a lot of times they won't give you the trade name on inputs, they give you the generic. So that's why you have to learn the little shortcuts to them. And if you know a zole means some kind of gastric pump inhibitor, then I know, hey, that's stomach. And then you can start looking at the rest of your question and figure it out. There's no way you'll know all these drugs. I still don't know all of them. Prevacid, Prevacid's in this group too. Prevent acid. See, that's what Prevacid means, prevent acid. They make up little names like that. Alright. Any questions on GI? Anybody got any other good ones you want to look up?
Zole's also
Yeah, I think so. But just remember, if you see that zole and they're talking about a patient comes in with epigastric pain, you're going to know there's something going on with their stomach, that this is probably an acid inhibitor. So read the rest of the question and see what they want you to do about that, okay? All right, let's take a break and then when we come back, we won't have long. Okay? Any questions on anything?